Welcome to Anti-Aging Unraveled with Dr. Lori Gerber. The body is one of the most complicated systems in the universe. Dr. Gerber and her guests explore integrative medicine and cosmetic dermatology, combining traditional medicine, alternative health practices, new innovations, and technology which work together to help you look and feel natural and age gracefully. Now, here is your host, Dr. Lori Gerber.
Hi, and good evening, everybody. It is 6 o'clock on the East Coast, and I am coming to you live with our new radio show, Anti-Aging Unraveled. I'm Dr. Lori Gerber, and I do have with me an amazing physician in the functional medicine and integrative medicine field, Dr. David Bleiweiss. He is the adjunct faculty at the University of Miami Miller School of Medicine and medical director of the University of Miami School of Medicine Osher Center for Integrative Medicine Conferences. That was a mouthful. He has been giving lectures all over the world on this topic, and I would love to share his wealth of knowledge and stories because they are wonderful with you all this evening. So, with a couple of technical difficulties we do have on the phone tonight, so without further ado, I will get him on, and he will start to kind of give us his story of how he got to come to non-traditional medicine as I did. All right, Dr. David Bleiweiss, are you there?
Dr. Gerber, I am here. Thank you.
No worries.
Thank you, and good luck on your show here. What you'll find with the older, when older, I mean the functional medicine docs who are certified and have been doing it for 15, 20, 25 years, is that we all had a similar story in how we got involved moving from conventional medicine to integrative or functional medicine. And my story is very, very similar. I got sick. My colleagues and friends didn't know what to do with all the drugs. I was in the hospital. By the time I got out, I had chronic fatigue and fibromyalgia. And my colleagues and friends gave me all the best drugs, Dr. Gerber. I got Percocet, I got Xanax, I got Paxil, and there I was, 20 hours a day on the sofa for weeks and weeks, bemoaning my situation. And my daughter came down the steps and said, "Daddy, are you a victim like other people you say are victims in medicine? I thought you're the guy." So that got me off the sofa and into changing my diet and lifestyle. Can't change my genetics, but I can change how they react to my environment, lifestyle, and food. And 12 weeks later, there was no medication in me, and I was fine. I had no chronic fatigue or fibromyalgia, and that's what started me on that pathway. So.
And how many years ago was that?
Oh, that was 1999. So about 22 years ago.
Okay, before I was thinking about medicine, probably, but I had a similar experience. So that's really how I got into this as well. I had my son, and after I had my son, I experienced an allergy to every thin-skinned fruit and every food under the sun, to the point where I really couldn't eat a normal meal. And traditional medicine didn't really tell me what to do. I was just finishing up residency and looking for answers, and I couldn't find anything. So that is what brought us to integrative medicine.
That's what medicine can't do, right? Conventional medicine can classically look for a way to hide your symptoms, but not actually get to the reason, the cause of why you have what you have. We didn't go upstream. You know, it's the old analogy where you're driving along and you have red lights going off on your on the front screen of your car, and it says oil, or it says, check engine. And what you do is you cut the wires so that the lights don't flash anymore, and therefore your problem's gone. Well, that's what conventional medicine did. We got rid of the symptom, but you still had the process seeding and brewing inside of you, and it would only get worse. So
let's talk about that a minute. I think that gives us a really nice transition. Traditional medicine, you're right, it just teaches us how to treat a symptom and not a cause or a problem, or where the causality comes from. And it really doesn't teach or address any of the interconnectedness of the human body. So
Right.
I love your stories about, how medicine started, how we've lost the art of medicine. I actually did write my first med school application essay on the art of medicine, which I do agree with you has been lost. So if you could briefly tell us some of your stories, you have some great stories about the roots of medicine and how we really ended up where we are.
Yes, I mean, remember the pharmaceutical industry got started back in the mid 1800s, and people know about the Bearish Corporation and getting Bear aspirin, and we used cinchona bark for quinine to stop the symptoms of malaria. Morphine and opium were huge. Heroin was huge. So the world was going towards a pharmaceutical-based treatment of symptomatology, and we still had the medical schools that were getting people better in I don't want to say alternative, because alternative was using an herb at the time instead of a drug. So this was more integrative. It was nutritional. If you had issues with your skin, and remember, doctors 100 years ago knew this, that if you had an issue with this, I'm sorry?
We're obviously talking pre-antibiotics as well.
Pre-antibiotics, right. Things like silver, right? Silver been used for thousands of years. They didn't know why it worked, but if you were a commanding general king, you wouldn't go into an extended battle without your water barrels being lined with silver. The settlers put silver coins in their water barrels to keep the water pure. My grandmother did that in her milk to keep it pure. They didn't know why. It was only about 100 years ago where the research began, even though we've been using silver for millennia. And it wasn't until, actually it was 1942, March of 42 in World War II, when penicillin became available on the battlefield to fight septicemia. And from that point on, silver got kicked out of the medical world, even though it didn't have any of those side effects that antibiotics do, right? Antibiotics will napalm your intestinal microbiome, whereas silver, the silvers today, the bioactive silver hydrosols, will not affect the diversity of the microbiome. They'll kill bad bacteria, some good bacteria, but things grow back. And so we started out with the schools that were teaching osteopathy, homeopathy, nutrition, acupuncture, meditation. And come around 1910, J.D. Rockefeller and Andrew Carnegie, who had put initial monies into the nascent American pharmaceutical companies, had Abraham Flexner go around. It's famous. It's called the Flexner Report, to standardize medical education. And what that meant to them was they gave $1 million, which, 110 years ago was real money, if those medical schools would drop teaching nutrition and homeopathy and acupuncture, meditation, and use these patented nostrums that they were the original founders of. And if you didn't take the $1 million and join them, the hospitals that they were building and the universities they were building that would connect to the medical school, you wouldn't be a part of it. And those medical schools that said, this is crazy, we're not going to do this, they all closed. And the ones that welcomed that money and hooked in with the hospitals and universities being built, they're the ones that are still around today. But they dropped all those other teachings. Even today, I think it's 24% of medical schools give a few hours of nutritional education. Nothing that you and I would recognize as nutritional education, but they some of them do a little bit. But again, you ask your doctor about nutrients and supplements, they have no idea. And classically, what they'll say is, I don't know anything about that, but it can't be good for you, even though properly prescribed medication is the number 3 cause of death in the country. So.
And that's why the subtitle is What Your Doctor Didn't Tell You. Because I do agree. We were not trained in any of this prior to coming out of med school, right? I mean, this was not something that was part of our curriculum at all.
Right. And the problem with that is that the half-life of medical knowledge is now something like 3 years. So when I hear doctors say, if I didn't learn this in medical school, then it's not real. Well, excuse me, doc, but you graduated 30 years ago. So you're 10 half-lives down of the information you should have to treat. And you know what it's like. I got off that rat race many years ago, not having to deal with the vagaries of insurance and the amount of time it took to pre-authorize somebody to get a medication that they needed, only to be told that it wasn't covered and find something else. Or, it's just awful. We're not physicians anymore, right? We're technicians. We're healthcare providers. We're not physicians. So, but you know how I feel about that.
Well, I do. And that is also when we talk about the electronic medical records and not having time for a patient, not being able to do a physical exam, not listening to what a patient has to say. I do pride myself on listening to symptoms, which, if you listen to someone long enough, they're going to tell you what's wrong with them.
Remember they told us that the first day in training. If you listen well enough and ask the right questions, the patient will tell you what's wrong with them. But we don't give that. What is the average time now? 18 seconds before the doctor interrupts the patient? 18 seconds? As opposed to my taking a history for half an hour, right? Or an hour. We're doing a physical for half an hour. I had family practice, chief of family practice for a major medical school on my exam table. We did the history of the physical. And when he got off, when I got done, he said, we don't do this anymore. We don't train for this anymore. And now I found, what was it, a month or two ago, that the National Medical Board is saying you don't have to train new physicians in clinical physical examination. You have blood tests, you have scans, 20 minutes, new patient, move on to the next one, write a script and move on to the next one. So, yeah, it's very scary. It really is.
It's no longer medicine as far as I'm concerned. And I feel like that's something our patients need to understand, is that this is something that unfortunately society has really pushed to the side, but monetarily speaking, it's all about numbers and what's good for the pocketbook of the larger person. And it's not always what's best for the patient.
Electronic medical records are for the insurance company.
Yeah, exactly.
They're not for the patient, right? So they know how much to pay you or what not to pay you. So you have to check off the dozens of boxes, or else you won't get paid. None of that includes hands-on examination or listening with a sympathetic or an empathetic ear to what a patient's problems are. So again, when I had the full practice, the functional medicine practice open, I only saw maximum maybe 2 or 3 new patients a day because it was 2 hours, right? It was 2 hours, and if I didn't hear at the front desk when that patient left that they had never had a physical exam like they had with me, then I know I didn't do my job.
Exactly.
So,
well, let's give the people what they want to hear. How about that? I've been having tons of conversations since COVID about chronic inflammation, and that is the topic of today's show. And I do want to point out that we're going to cater it a little bit towards COVID at the end. My patient did have to cancel last minute for this evening, but we will discuss a little bit of the COVID implications with chronic inflammation. But I think it's important to realize and for people to understand that chronic inflammation is something that can be caused by a million different things. And the gut is one of the biggest, at least in my mind, things that can create chronic inflammation. You just talked about how you changed your lifestyle and your eating habits and really just got rid of your inflammation, right? So I think we can start by talking about what are the causes of chronic inflammation. What are we want to start with gut primarily, but what are the other things that are out there that might make the body not work effectively? I always call it short circuiting because I feel like that's the best way to describe it. It's just your body's on overdrive going around and around in a circle.
Well, depending on what we eat. I mean, there are foods that are inherently inflammatory. People talk about red meat. Well, it's not all red meat. It's red meat that is not grass-fed and organic. It's red meat that has herbicides, pesticides, antibiotics, and hormones in it. Did you know that the bovine growth hormone that they inject into cows is only one amino acid away from human growth hormone? So you're getting something that is so close that if you get an outside exogenous boost of human growth hormone long enough, consistently enough, you may grow cancers that were very tiny, because now there's a growth hormone in there doing that, as well as the inflammation from meat that is not grass-fed. So basically, foods we eat, grains are inherently inflammatory. Classically, wheat is. Sometimes it may be gluten and not gluten. And again, with gluten, you're looking at, barley and rye and wheat primarily. Oats, not so much, unless they're stored in a facility where wheat is being stored. But again, obesity, chronic obesity. Most people carry around the seeds of their illness in their fat. You have fat is inflammatory. Fat is a depository for estrogen. So we know that you double your risk of breast cancer as a woman if you're morbidly obese, or if you're taking birth control pills for an extended period of time. I think it's from 15 to like 35. Alcohol causes gross inflammation. Smoking causes gross inflammation, and chronic ongoing stress. Do you think we have any of that this year? Chronic ongoing stress. So those are the top, right? The top contributing factors. But again, people should realize that acute inflammation is critical, because that response will include the release of antibodies and proteins. Acute inflammation usually only lasts a few hours or days. Usually, when you cross the line to chronic inflammation, now you're going to play into asthma, cancer, heart disease, neurodegenerative disease, because those are all secondary to that level of chronic inflammation.
So how long do you think it takes to get leaky gut or a chronic inflammation in the gut? I think that's a good question. People say, well, how long do I have to eat healthy for this to get better? Or how long does it take to heal up?
What a good question. What a good question. Do you know that it only takes 5 days for the intestinal lining to remake itself?
And how thick is lining? It's only one cell thick, right? So.
Well, and if you change your diet, you're going to change your gut microbiome, the good bacteria in there, and you can change everything within a week. Remember that the intestinal epithelial lining is only one cell thick, right? And that, with some other factors that are the mucus secreted from it, that forms a barrier that separates us from our external environment, right? Our gut is inside of us, but it's also outside of us. So in pathological conditions, the permeability of the epithelial lining can be compromised. And if you have little openings in it, now you've got toxins, antigens, bad bacteria, specifically the gram-negatives with their lipopolysaccharide, major component of their outer membrane, gets through to your body, and you're sick. We used to give lipopolysaccharide to medical students to test to see if they would get sick from it, and indeed they did. So it wasn't even the bacteria, Dr. Gerber. It was the coating of the gram-negative bacteria that was making people sick. And the same inflammatory biomarkers that they showed were the same inflammatory biomarkers for people with major depressive disorder. The same sick symptoms, I'm not getting out of bed, turn the light off, I don't want to eat, leave me alone, no, I don't want to canoodle, right? And all these things occurred from chronic inflammation, whether it was due to a virus, a flu virus, or whether it was due to a lipopolysaccharide from a gram-negative bacteria that got through the lining of your gut. And so how do you do that? Well, gluten will cause that. Gluten will cause the secretion of zonulin, which will open up the barriers and allow awful things to get into your bloodstream. So that's
why we call it leaky gut. Really, I mean, people ask me that all the time, and It's just the increase in intestinal permeability. It's not truly leaky. It's just your body is seeing things as foreign that it ordinarily wouldn't.
Right. I mean, it sounds good. If you want to be exactly correct, it's an abnormal intestinal permeability going on.
Right.
And, right? So stress will cause leaky gut. Gluten will cause leaky gut. Other levels of chronic inflammation and causes will cause leaky gut. And in people who have a genetic predisposition, a leaky gut will allow environmental factors, toxins and allergens to enter the body and trigger that initiation and development of a disease, specifically an autoimmune disease. So, it's really important to keep your gut healthy and your lining healthy. And we know that gut microbiota supports the epithelial barrier and the mucus, right? So we've got, I think it's 3 millimeters of mucus that are on top of the enterocyte, on the epithelial cell of the gut. And once you get through that, you're getting into the body, and you really shouldn't be doing that.
So you hit almost all of my points from the next 3 paragraphs, by the way. But
I'm sorry.
No, it's all good. We like it. You had a lot of information there, and it was perfect. So you talked about LPS and the importance and how it basically creates this inflammatory effect and autoimmune effect and can create basically leaky gut, right? So the question that I think a lot of my patients have and that I get asked all the time is, one, how do I know if I have leaky gut? What tests can we do to see about leaky gut? That's probably the first and foremost question that I get.
And what do you tell them?
So I tell them most of the time what they're telling me and their symptomatology will tell me if they have leaky gut, to be honest.
Right.
I don't need a lab test.
Enough, they'll tell you what's wrong.
Exactly.
Right.
Although I have seen some really great testing that I've done more recently. Maybe it's the geek in me that just loves the testing that tests for zonulin and expression of antibodies to various gut proteins. So you can actually see if you're fighting. The lack of a better way to explain it, fighting your own gut, right? So you can check for antibodies to various proteins.
Right.
Yes, it's probably a little bit geeky, and yes, it's definitely not covered by insurance. But the positive predictive value of that is excellent. And you can actually quantify that when people change their diet. I've watched it very quickly, and I agree with you. Within about 7 to 14 days, I'm able to see a massive shift in antibody response, especially with zonulin and some of the other proteins. So
right.
I don't know if you've done any of that yet, but
well, you have to be careful once you know what's going on. And you tell people there's going to be a change in their dietary lifestyle. I don't put people on diets because people go on diets, and by definition, they go off diets, right?
Sure. Lifestyle.
So if you do you're doing a dietary lifestyle. It's, you know what? I don't add extra sugar anywhere, which is inflammatory. Or, you know what? I am gluten-free, and I've discovered all these other great gluten-free products, but I'm gluten-free, and when I eat it, I sort of feel sick, right? I don't know if it's gluten or gliadin, but if they stop wheat, they're feeling better. What about probiotics? People don't know they don't know. I say, probiotics, go, I take a probiotic. It's like, so what is it? It's a probiotic. Well, okay, my favorite probiotics are those that have the viable non-pathogenic microorganisms, right, as well as the prebiotics to feed them in the capsule, as well as the postbiotics, which is the products of metabolism of the prebiotics with the probiotics. And what are prebiotics? Basically plant-based food. And now they're putting some of that into the capsule. Those are what I want people to take, and I'd like them to take it at bedtime, so I have, hopefully a good 7 or 8 hours of reinoculation. And my personal favorite is those probiotics that have Saccharomyces boulardii in it, the good yeast, because that good yeast keeps the probiotics in the gut for about almost 2 weeks. Because probiotics are not inherently yours; they're coming in, they're going out. You want them there as long as they can. But if you're getting people to change their microbiome by their diet, I tell them, don't be such a hero. Don't go so fast. Don't suddenly become 100% vegan because you're going to fart a lot. Because that soluble/insoluble fiber with the bacteria will metabolize what it's supposed to do, which is making gas. Is it methane? Is it hydrogen? It's still gas. And the average person toots 40 times a day, even though they may not know it. Obviously, some people do that more, but you will start getting more gas production, and people will stop their dietary lifestyle change because they have too much gas. So I have them go slow. Interesting article came out because, I have discussions with friends of mine who are in the functional medicine world about veganism versus red meat causing cardiovascular issues because meat causes trimethyl amine oxidase and goes from the gut and then through the liver, and then suddenly your coronary arteries are doing bad because of the red meat you're eating, and how it affects the gut microbiome, or what gut microbiome is changing the meat. Well, as it turns out, if you are basically vegan for 6 solid days, 2 or 3 meals a day, and then on a Sunday you have 4 ounces, 6 ounces of whatever good grass-fed organic meat that you want to eat, it doesn't change your microbiome, and the TMAO level doesn't elevate. So people don't have to... Say what?
It goes back to moderation,
It goes back to moderation. Yeah, moderation is for monks. And, they live to be 90 years old and they look like they're 30.
Exactly. All right. So we addressed probiotics, and I 100% agree with you. Saccharomyces boulardii, Saccharomyces rhamnosus. I tell my patients all the time, look on the back of your bottle. If you don't know I always say bugs, but if you don't know the bugs that are in there, then don't tell me that you're on a probiotic. So, you want to be on something.
Any favorites?
You know what? I do. I love orthobiotic by Orthomolecular. It is one of my favorites.
So do I. Mixed bacteria, good amount, Saccharomyces boulardii. The 2 other ones I like is Probulin, Probulin, and Dr. O'Hara's. Now, Dr. O'Hara's has the prebiotic, probiotic, and postbiotic in it, but he also has the vegan capsule that has been made to withstand stomach acid so that it will go into your intestine. And some of the others will be destroyed in the stomach, especially if people are taking with a meal and they've got gastric acid being secreted. But those are my top 3, orthobiotic, Probulin, and Dr. O'Hara. Yeah.
So, when you're
especially
treating
if you're on an antibiotic.
Yeah. Oh gosh, you should be taking 2 a day, most likely. Let me ask you a question. So, I have a million patients who come to me and say, well, why hasn't, we already addressed the problem of why hasn't my doctor told me about my gut being my primary source. But when you address a patient and they're coming to you with inflammation, autoimmunity, something maybe you think is chronic infectious, or exposure based, do you ever try to treat them without treating their gut? And there's probably a very simple answer to that.
Oh, no, never. Never. No, you go with the gut. Literally.
You always go with the gut, right?
Gut, you go with their gut. That's always.
It's almost my...
you've got 2/3 to 3/4 of your immune system is in your gut, right?
Yes.
90% of the serotonin that your brain uses comes from the enterochromatin cells in the gut, in the intestine. You tell that to people. You say, listen, you need the right microbiome to make your B vitamins. It also works. It has neurotransmitter receptors, and it also makes neurotransmitters, certain bacteria. So it's critical that you treat the gut. I got 2 emails today from 2 follow-up patients, 2 consultations, that within, it was 10 days, they said, I just feel so much better. And part of that is that they're pooping good. When I have people who say, well, I go maybe, every other day or every 3rd day, and it's like, well, let's see if we can literally, pardon the pun, move that along. And my best patients who follow advice, directions, they have what's called gastrocolic reflexes. So, first thing in the morning they have a bowel movement, or within 20 minutes if they're eating breakfast, they'll have a bowel movement. And a half hour, an hour after lunch, they'll have a bowel movement. And the same thing after dinner, a gastrocolic reflex. Food in, waste material out. But the longer you keep the waste material in your intestine, the more absorption you get of bacteria, of potentially pathogenic microorganisms. So
what besides diet, obviously, and we talked about probiotics, what are some of your other go-to, and I'm leading into really some of your knowledge on silver. Honestly, colloidal silver has been one of my favorite products for probably the last 10 years.
For supplements that reduce inflammation,
yes.
Fish oil, alpha-lipoic acid, curcumin, they're all linked to decreases in inflammation. Spices, ginger, garlic, cayenne, other foods that'll decrease inflammation, olive oil, your leafy greens, obviously organic to these, tomatoes. Some people worry about the lectins, pull the skin off then. Fatty fish, right? Salmon, sardines. The lower you are on the predatory chain of seafood, the better off you are. One, because you're going to get a good amount of fish oils, and two, you're not going to get the level of mercury that's in the higher predators, the tuna, the shark, things like that. And again, cherries, blueberries, things with a lot of flavonoids, things that increase inflammation. White rice, white wheat, refined carbs, fried foods such as French fries. Still love French fries. But I do know that when you fry that carbohydrate, or most carbohydrates at a high temperature in oil, you're going to make the acrylamide, which is carcinogenic, right? Red meat that's not organic, and then processed meat. So those things all cause inflammation. But silver, I mean, you're asking what's exactly the question you're asking about silver?
Let's just talk about silver, and let's talk about silver for a minute. So let's talk about the history of silver. You gave a little bit of the history of silver and talked about silver being used as an antibacterial in water bottles. Silver spoons. I mean, there's tons of history with silver. Born from a silver spoon, right?
Silver. That's right. And that's funny because it was the wealthy or the aristocracy in England who had the money to put their water and wine and milk and food in silver containers. They drank from silver goblets. They ate from silver plates. And when the Great Plague hit London, 1348, 1349, those people did not die anywhere near the level of everybody else that got the bubonic plague because they had lower doses of silver chronically circulating in them. Now, granted, it wasn't the best silver. It was, large particle silver that can cause you to become blue. Nowadays, the new bioactive silver hydrosol, and again, the only company that has it at that level is Natural Immunogenics, right, with Argentin and or Sovereign Silver for general population. But it does so much more. I mean, it's in the last 2 years, they found that silver makes the white blood cells mature and active, and they even throw out what's called nets, neutrophil extracellular traps, to trap pathogenic bacteria outside of the cell.
Yeah, I find it fascinating.
So it's just fascinating, and plus the silver hydrosol, those nanoparticles actually clean up the debris after the destruction of those bacteria or viruses. So it kills them and then actually clears them up. The silver will attack the cell membrane, primarily gram-negatives, because they have a very thin peptidoglycan layer around them, which is why they don't gram-stain positive. The gram-positives gram-stain positive and purple because they have a peptidoglycan layer that's 8 to 10 times thicker. So the silver's not going to get through that quickly. Once it gets through into gram negatives, then it's going to attack the internal ribosomes and proteins and bind them, and binds the genetic material so the bacteria can't reproduce. But because they poke holes in the cell membrane, at some point, because of the internal pressure of what's in the bacteria, it explodes. It obliterates. It disintegrates. And I saw a great video of that. And after you see that, you go, you know what? I need to take my silver.
Right.
I had a 20-something-year-old patient. She was living with her boyfriend. She was in healthcare, and he got diagnosed with COVID. They're in an 800-square-foot apartment. And she says, so I was lost, but, I didn't get sick. And we're living together, and we're breathing the air. And I said, and what do you ascribe that to? She goes, well, I'm taking the curcumin. I said, you're taking your Argentin? She goes, oh, yeah, I'm doing the sprays up my nose, 4 times a day, and I take my teaspoon under the tongue for 30 seconds 3 times a day. I said, so with your extra vitamin D and your zinc, with her quercetin and green tea, because you remember the brouhaha over hydroxychloroquine?
Yes.
You
can forget.
Okay. Well, quercetin and green tea are also ionophores, just like hydroxychloroquine, and they bring zinc into the white blood cell to fight infection. So if you're taking your zinc and you're having green tea or quercetin tablet, your vitamin D level, hopefully you're getting it up to about 70 or 75, especially if you have an autoimmune history, an autoimmune disease, and you're taking your curcumin with the silver, you're not going to have the cytokine storms that people were dying from, because the silver controls inflammation, and the other products help generally your immune system, plus a good probiotic. So she did all those things.
Stole my thunder.
I'm sorry. Go ahead.
That's okay. That was the follow-up question. It's all good. You keep going. You're right on it. I mean, the question that I was going to ask you after how does silver help us was, I know we can't talk about treatment or healing things, but have you used silver for COVID? So have you nebulized it as well?
All I can say is, in my experience,
my clinical
experience,
yes,
right. Docs I know who have been using it have written me or called me and said, "This is amazing. I know you can't say anything about it, but I have a patient." This was an ER doc out in California. Patient, his SpO2 was 90. He was short of breath, and he was off color. And he was coughing, but he wouldn't go into the ICU at that time to get on the ventilator. So he went home with a nebulizer and a bottle of Argentin from this doctor. And he nebulized the teaspoonful 4 times a day. And by the end of the second day, he had no symptoms. His color was back. His SpO2 was up in the 96 range, and he kept on doing it. And he goes, it's got to kill COVID. I said, we can't say that. It's not a drug. It is not intended to, treat, diagnose, or cure any disease, because it's not an FDA-approved drug, and will never be FDA-approved because there's no patentability on it. There's no way for a drug company to make money on it. So, and then 2 articles came out, September 11th, and then I think about 6 weeks ago, 2 separate independent clinical trials on silver nanoparticles and COVID virus. Well, they started out knowing that the silver nanoparticles, the bioactive silver nanoparticles, kill SARS-1. That's known. Kill SARS-1, respiratory syncytial virus in kids, Hep B, HIV. So they had a starting point, and it came out, both studies, that the silver nanoparticles killed the SARS-CoV-2 virus. But you can't promulgate that because it's not a drug. And you saw what happened with some idiots who went out there saying their silver, some really crappy silver, unfortunately, cured everything, and the government jumped on them. So the companies that have the only silver to use can't say anything.
Yeah, and I actually
go again.
I've been using it since probably April, maybe May, when I was doing a lot of COVID testing early on, and I've been using using silver in my COVID and post-COVID syndrome patients for months and months and months now, with a lot of clinical data to suggest that not only does it shorten the course, but for my long haulers, my post-COVID syndrome, the inflammation decrease is exponential, and and additionally helping with taste and smell to come back. So, I feel like
I didn't know that.
I've been having tons of good success with that. That and I use something called Biocidin. I don't know if you're familiar.
Oh yeah, Biocidin. I know that.
So
well, you want to get their curcumin up.
Exactly.
Also.
Yes.
If they have some fatigue, you also want to bump their CoQ10 and then their magnesium, not the one that makes you poop too much. I like the 3-in-8. I actually like OptiMag Neuro, the mixed berry from Zymogen. But you want to get the mitochondria back online, and that's going to be CoQ10, magnesium. Remember, you can't make ATP without magnesium because it's got to hook into magnesium ATP. So if people are deficient in magnesium, they're not going to have the energy levels that they need. So I would add those things. I think what you're going to see is come flu season, September, October, November, people who have gotten both injections of the mRNA are going to have massive reactions, and those people will probably need to up their supplements that we've spoken about just now to keep themselves
an abnormal flu response. Is that what you're saying? Like an exacerbated, yeah.
I mean, they could, and we won't see. I mean, this is, we're all in an experiment right now because there was no time to do a phase 3 open clinical trial on the Pfizer, Moderna, or any of these. So we're all in that genetic experiment. Someone asked me about the vaccine. I said, just so we're clear, I mean, you're taking it and you want to be safe with this and that's going to help. It's not a vaccine, right? Vaccines prevent people from getting a disease or spreading it. This does not prevent you from getting the disease. These are made to make sure you don't get that sick that you're in the hospital and you could die. But you can still get the disease, even if you get these shots, because by definition, they're not a vaccine.
So let me ask you a question. When you talk about, and I'm shifting back a little bit, but when you talk about COVID, because we have a couple of minutes left, and we're comparing it for chronic inflammation purposes, right? What is your take on the pathophysiology of this? I mean, I have said since probably day one, April, that COVID to me is like Lyme. Okay. It's a chronic turn on of the inflammatory system. And I'm personally not convinced that it completely disappears out of your system at this point. Now, do you have any thoughts on the chronic inflammation pathways? How is it getting chronically turned on? I mean, obviously we know that the treatment protocols are very similar. The quercetin, the Biocidin, the glutathiones, the NAC, MAG, silver. But what's your thought on it? I mean, I have some thoughts on it as well, so I'm just kind of curious.
My thought that although SARS, the CoV-2, the virus primarily causes lung infection, right? It binds on the H2 receptors in the nasal epithelium, and then down onto the alveolar epithelial cells. We now know that they found it in the feces of infected people. And we also know that the intestinal epithelial cells, the enterocytes that we're talking about of the small intestine, also express the H2 receptor. So people who don't have a strong gut microbiome, they're going to get sicker more. We know that respiratory viral infections cause some perturbations in the gut microbiome. So diet, environmental factors, genetics plays a role in shaping the microbiome, and that's going to shape your ability to decrease inflammation if you get infected. So it will stay around. I think the mRNA which usually is destroyed in a short period of time, you're still leaving some protein, the spike protein that could get into the basement membrane and cause an issue, 6 months, a year later. That's my concern. So it's like I'm keeping my family hopefully safe by making sure that they take their supplements. And I think it's going to do what most viruses do. It's going to mutate where it becomes endemic in the population at a lower level. And remember, we have retroviruses that became part of our DNA over millions of years, right? You can't make the syncytial trophoblast in the uterus, in the amniotic sac, without a retrovirus that became part of our DNA. In other words, if we didn't have a certain virus that became part of our DNA, then we wouldn't be able to have live births, stupid stuff like that. So it's going to do what other viruses do. It will circulate. It's going to be endemic. And it's going to stay around.
As much as I don't want to wrap this up, I have to wrap this up. And I just lost power for 2 seconds and got power back on as well. So as if the technology difficulties couldn't get any easier or worse. If you guys want to hear more about this topic, feel free to message me after the show at info@mydrlori.com, mydrlori.com, and tune in next week at 6 o'clock Eastern Standard Time, Wednesday, and we will be able to give you some more information on some of these interesting topics. And Dr. Bleiweiss, it's been a pleasure to have you on. I do appreciate it. And anyone with post-COVID syndrome, there is hope for you. That is what I have to say, because we can treat this. I know we can help make it better. All right, guys.
Thanks so much, Lori.
Thank you. Bye-bye.
Thank you for tuning in to Anti-Aging Unraveled. Be sure to join Dr. Lori Gerber again next Wednesday at 3 p.m. Pacific Time and 6 p.m. Eastern Time on the Voice America Health and Wellness Channel. We'll talk again next week and keep you aging gracefully.